All right, well, thank you for all coming today. I really appreciate everyone coming out. And our topic today is urinary tract infections, which is a very important topic. So we're very lucky to have Kayla DiTomaso. She's a nurse practitioner from Lincoln Physician Group. Unfortunately, Dr. Parmelo was, for personal reasons, was unable to come today. She had to cancel, so she's in the same practice. Kayla works with her and is very, very knowledgeable on the subject, so we're very lucky to have her with us today. And she was also kind enough to, print out her PowerPoint presentation, so you can follow along with that in the handout that Kayla has provided. So thank you all again for coming, and I'm going to hand it over to Kayla, and she will discuss it and give us some great information on urinary tract infections. Thanks.
Thank you for having me. So yes, the topic is urinary tract infection, which is a really common and important problem to learn about here. So I'll start off by what is a urinary tract infection. So urinary, or UTI, is what we commonly know them by. UTIs cause redness and irritation to the lining of the urinary tract. And there's different components of the urinary tract, which includes the kidneys. That produces urine by removing waste and water from the blood. You've got the ureters, which are tubes that carry the urine from the kidneys to the bladder. And then the bladder is the sac-like container for storing urine. And then the urethra carries the urine from the bladder outside of the body. Different parts of these systems can be affected. So if there's a kidney infection, that's called pyelonephritis. That's a really severe infection, typically causes you to be very ill, can cause a lot of back pain where the kidneys are located, and also can cause fever. When the urethra is infected, that's urethritis, and the bladder, when that's infected, is called cystitis, and that's the most common infection of the urinary tract. And this is just a diagram to show you kind of where the kidneys are. This is the kind of anterior. The kidneys, you can see the ureters here that carry the urine to the bladder. The bladder is that sac-like structure, and then the urethra that carries the urine out of the body. How common are urinary tract infections? They're very common. 1 in 5 women will get a urinary tract infection in their lifetime. Men also get urinary tract infections, not as commonly as women, and that's because of our anatomy. Unfortunately, women are a little bit more susceptible because our urethra is shorter and is in closer proximity to the anus. And the anus carries a lot of E. coli, which is commonly found there, and that's how women typically get more urinary tract infections than men. And about 8 to 10 million office visits to medical offices occur every year for urinary tract infections. And who gets UTIs? So both men and women do get the urinary tract infections. And again, just a little bit more common in women because of the urethra and the proximity to the anus. Older adults are more commonly affected for a couple of reasons, or more than a couple of reasons. Incomplete bladder emptying. So when you're not, which can be due to certain medical conditions, it can be because not hydrating well enough. The longer urine sits in the bladder, it's more susceptible to infection because bacteria can kind of thrive from the inside of the bladder there once it gets in from the urethra. Bladder prolapse, so that's when your bladder falls or slips basically out of the urethra. It's another way that you can get infected by different microorganisms or bacteria. For men, enlarged prostate, because when you have an enlarged prostate, you can also have incomplete bladder emptying. So again, the urine kind of sits in the bladder and you're more susceptible to infection. And a really big cause of urinary tract infection is because of estrogen deficiency. So after women go through menopause, we lose a lot of that estrogen that was once in the tissue. And that's because of the lack of estrogen and kind of dry tissue in the vaginal area, urethra, that can cause infection as well. So what are the common symptoms of urinary tract infection? And so pain with urination is a common symptom. Pain in the flank, so on the sides or back, in the abdomen, and in the pelvic area. So the bladder sits kind of in the suprapubic area here, so having pain or tenderness along this area. Blood in your urine, you can see sometimes the blood, though sometimes it's microscopic, so we don't see it with the naked eye. A strong or foul smelling urine. The need to really go to the bathroom urgently, but then when you go to the bathroom, not a lot of urine comes out. Frequency, so going to the bathroom multiple times for feeling like you need to urinate. Incontinence can also be a contributing symptom. Nocturia is increased urine at nighttime. So some people come in to me and say, I usually go to the bathroom once a night and I've been waking up 4 to 5 times a night. I don't know what's going on. So that can be a clue into having an infection. We sometimes see fever and then also change in mental status. It can cause confusion or change in mental status in some people. So how do we test for UTIs? The tests that we commonly use are the urinalysis. Some of you have probably gone into your office and we do a dipstick test, which is the picture here. What we're looking for on this dipstick is any sign of infection. So if there's some white blood cells, if we can't see the blood in the urine, but we dip it, there's a little indicator for blood. And then a nitrate is also typically positive in a, for sure, urinary tract infection. If we see any of those indicators on the dip, we usually send your urine out for urine culture. This takes a couple of days, but it will show us exactly what bacteria is growing in the urine, and then it will also give us a medication, so antibiotics that we can use to treat. So it will tell us which ones will work and which ones are resistant. Did everyone see okay? So how do we prevent urinary tract infections? Good hygiene practice. So wiping from front to back is important, and really that reduces dragging any sort of E. coli bacteria from the rectum to the urethra. If anyone wears any feminine pads or any sort of lining, to change those frequently because bacteria thrives in those areas and can enter the urethra and cause infection. Urinating frequently, so that helps to empty our bladder. The more you can urinate. And that will flush the bacteria to reduce infection. Hydration is very, very important to do that, urinate frequently. So really aiming to drink at least 6 to 8 glasses of water. Some people have trouble just drinking plain water, but actually putting a little bit of lemon, squeezing lemon into water, or you can mix a little bit of cranberry juice with water because acidifying the urine can help reduce risk of infection there too. And then to continue, in sexually active individuals, making sure to urinate before and after intercourse to reduce any sort of bacteria in that way, and using a water-based lubricant during intercourse, and because that can provide some moisture to the dry tissue, and kind of reduce the risk of bacteria there. Estrogen cream, is also a great way to reduce urinary tract infection. It can be contraindicated in some patients, so it's more of an individual basis. But sometimes, for example, we'll prescribe estrogen cream for someone who's had more kind of recurrent UTI. So having 2 to 3 UTIs in the last year or so, sometimes we prescribe this cream. And it's what it does is help change the pH balance in the vagina, and that makes the bacteria not as adherent and to reduce the risk of infection. And in the Cochrane review in 2008, it was noted that you can reduce UTI reoccurrence by 50% with that measure. And estrogen tablets are not recommended for UTI prevention. It's mostly the cream that we recommend. And other products, there's some, there's studies that are ongoing about cranberry products, vitamin C, and D-mannose, so I want to touch base on just a couple of those. cranberry tablets, so there are ongoing clinical trials on their effectiveness and what dosages, are recommended to help with the urinary tract. But cranberries contain, and I'm going to butcher this, the proanthocyanidins, which these are polymers that help prevent bacteria from sticking to the bladder, to the urethra, to all these urinary tract components. And cranberries, similar to vitamin C, also help to acidify the urine, which also reduces bacterial growth. It is a low-risk intervention, so we don't have a lot of scientific data to prove it, but there's really no harm in doing the cranberry tablets. And there is some ongoing testing on 36 to 72 milligrams. Generally, when we recommend it, it's about 250 in the over-the-counter tablets, 250 milligrams to 500 milligrams per day. And cranberry tablets are a better option for a couple of reasons. They cause less acid reflux, and the juice can also cause nausea, especially in patients with diabetics who also have more propensity for urinary tract infection. Cranberry juice isn't a great option because it has a lot of sugar, so the tablets are a much better option in that case. Has anyone heard of D-mannose or used D-mannose? Yeah. So D-mannose is a natural sugar, and what it does, it's a compound that mimics the host uroepithelial receptors. So basically this sugar will stick to the receptors, trying to basically competitively go against the bacteria. So that's the way in which this is theoretically supposed to work. So decreasing the bacteria that attach to the mucus in the urinary tract. We do sometimes, again, give this to patients who have recurrent infections to see if we can reduce their risk and not have to keep them on antibiotics for longer periods of time. But again, the published data on the efficacy is still in the works, and not a lot of data to show if it's effective or how effective it is to date. But more to come, I'm sure, in the next year on that. And that is it. Any questions? Comments, concerns? Yes.
How do you take the D-mannose?
D-mannose, it's daily medication that you would take. It's prescription, although there's some over-the-counter products as well. But you'll have to talk with your doctor because they can send in a prescription for the D-mannose, and it's a tablet.
What about prophylactic antibiotics?
Mm-hmm.
Some
So we don't like to keep anyone on long courses of antibiotics, but post-coital, so post-intercourse, we sometimes do a short course of Bactrim, something that's a little bit more broad spectrum. So Bactrim, Macrobid, Cipro, and we would only keep you on it for, a couple of days to maybe even one day. So we do implement that sometimes, just not longer courses, just because resistance can be an issue at that case.
Mm-hmm.
What about herbals?
What was it?
Herbals?
Herbals, so probiotics are not recommended for urinary tract infection. The only real kind of herbal natural remedy is the cranberry tablet or juice, though cranberry tablet is a little bit more effective. Vitamin C tablets, and the D-mannose is more of a natural.
Saw palmetto is not.
That can help more with BPH and such, so you could certainly try that because that can relax some of the muscles, kind of the prostate there. So that you could try, though I don't know how much it would have helped in the urinary tract.
A physiology question. I've heard one medical person say, drink a lot of water because it flushes out those kidneys, and that's a really good thing. Mm-hmm. And another medical person say, don't drink so much water. It's really hard for your kidneys to have to process all that. Can you straighten that out for me?
Yeah, so if somebody has baseline, if there's kidney disease and, there's other situations like congestive heart failure where we can't really overload you with fluid, that's not recommended. So, it's kind of told drink half of your body weight in fluid ounces. So really not, and also you don't want to overhydrate because you can cause disturbance to your electrolytes as well. So there's not really, 6 to 8 is kind of a safe range, because that's about, 48 ounces to 64 ounces of fluid per day.
6 to 8 glasses.
6 to 8 8-ounce glasses.
Probably a good suggestion would always be, is to check with your doctor.
Yes.
Because if you do have other issues going on with your heart or your kidneys, or there is something, I always suggest you just check with your doctor that you aren't on some kind of fluid restriction that could be heavy.
Right.
Although you want the fluid to try to help
Yeah.
keep the bladder
But there are
infections down.
certain things that can change those kind of guidelines for fluid. So it's really on a more individualized basis to
Well, this was individualized, so it really was confusing.
yeah.
It still is confusing, right?
What?
It still is confusing, or
Well,
is it?
yeah, I mean, you can add it up either way.
Well, personally, if you're my patient, I would want to know what your kidney function is, what you're taking, what are your other medical conditions that could complicate that matter. But you see Dr. Parmelo, so you can talk with her.
So lab values would be important to
Yes.
monitor, yeah. Lab values.
Yes.
Is it true that as you get older, you have less feeling of something wrong with your bladder infection? Last year, or this year, I don't remember when, it was just some time ago, my daughter noticed that my mental stage was a little off.
Mhm.
But that's why she said, you better go see doctor and get urine checked.
Yes.
And sure enough, I had an infection. And when I had an infection, I recall when I was young, I had the feeling of I had to go to the bathroom, very more noticeable
Right.
discomfort. Whereas in the last few times I had, my
Yeah.
daughter had to notify me.
Of the change.
And I was amazed how she knew and how infrequent the occasion was, and yet she found me in a position.
Mm-hmm.
And
That was a really
I
good
was
pickup
very
on her part.
puzzled. So,
Yeah.
does it have anything to do with aging?
Your symptoms can change as you age. And, when you get a urinary tract infection, when you're kind of in like you said, kind of in your teens or younger years, you had different symptoms. And, the symptoms these are common, but not everybody presents with urinary symptoms. So that certainly can change with age, just due to, the receptors and such in the bladder and the urethra. So those can change. But that was a really good pickup on your daughter's part.
Those daughters seem to know everything.
Oh, that's true.
We won't comment on that.
That's great.
Yeah. Any other questions?
It's true that sometimes people will say that some of those common symptoms that you just didn't realize until you're very sick or some kind of a severe.
And that's the thing. Sometimes, if your infection has, gone into the kidneys, well, you might not actually have the burning
Well,
or
then you
the
have fever and the more
exactly.
severe symptoms, but I was glad that I didn't have dementia,
Mm-hmm.
like after I cleared up,
Mm-hmm.
I became normal.
Yeah. But that's actually a good point, actually. People who have any sort of memory impairment like a dementia or Alzheimer's, sometimes, we can't rely on symptoms, but the change in mental status is something that we notice or is reported, and this is something that we often check initially to see if there's something going on. So that brings up a good point there.
So just a question, if someone does have a history of urinary tract infections and some symptoms that, just don't really portray as, the usual
Yeah.
symptoms, do you recommend your urine culture being dropped off at different intervals a couple of times a year, or
Yeah.
check, or?
Certainly if there's any, any sort of symptom, or maybe a different symptom that you didn't have before but seems to be related, I think, it's a really non-invasive test to really just get a urine to make sure that there's not an infection going on. often too, even people who get frequent urinary tract infections, when we treat them, sometimes I say, can you bring a sample back after your treatment? Because I want to be sure that that infection has cleared. So I often will do that, especially in case where, if you're getting a urinary tract infection every couple of months, I want to make sure that that's cleared there.
And what do you find in your practice to be maybe the best preventive treatment?
The
I
best.
know it's individual, but the best, if you were
Yeah.
to say one or two.
I think hygiene is very important, and really, hydration is really important. I don't think, as we age, we lose our thirst mechanism, so we don't drink or our body is not really telling us to drink as much as we should be. Again, it is individualized, so I can't really give you a specific fluid ounce to drink.
Please do. I'm waiting
Without
for that.
looking at different pieces of your medical history and such, but really hydrating well is the best to really flush out that bladder, so there's not as much opportunity for infection.
Is it important to avoid sugar and sugar products and an excess of carbohydrates, which eventually turn to sugar?
Yeah,
Say no.
in diabetic patients, that's important because diabetic patients can actually be more susceptible because of the sugar, yeast overgrowth can introduce more bacteria. So in diabetic patients, though, I'll tell you to watch your sugar in general for everybody because that's important too. But not so much, you don't have to limit to a certain amount, but in the diabetic population, it's a little bit different of a case.
Well, I was thinking of someone who's non-diabetic who might avoid sugar if that's beneficial.
I don't think you need to avoid all sugar. And the D-mannose, that what I'm talking about, is actually a sugar. So that actually helps or competitively fights for, a spot in the bladder. So to really kind of reject any bacteria that's trying to adhere. Did that answer your question, Michael? Okay. Any other questions?
What
Sure.
form does that D-mannose come in?
It's a tablet. And it's a prescription we generally send, though there's some over-the-counter products that contain this, but we typically send it in as a prescription. Yeah. And I think, there's more evidence to come with the cranberry, but cranberry, lemon, vitamin C, they all acidify the urine, so that can help. And I know patients tell me all the time, well, I'll try to drink, but I hate water. Well, just trying to put even just a little bit of lemon or, mixing a little cranberry juice with water for a better taste, for you to hydrate better, and to really empty your bladder more frequently and more fully.
So if you use stevia, that doesn't matter?
That's okay, you can use stevia, yeah, but it's not gonna act like the D-mannose, because those are different polymers that,
So when you say cranberry juice, are you talking about the natural?
Yes.
Without sugar?
yes, the cranberry cocktail does not work, it's the,
full of sugar.
the cranberry 100% juice is the one, but that one too can cause some acid reflux and nausea, so the cranberry tablets are preferred to really reduce on those side effects potentially.
What about raw cranberries, ground up, blended?
That could help because you're digesting and it acidifies. That could help. Though I think that would be bitter and could potentially cause some of that reflux as well.
You haven't said much about incontinence for older people.
In
Often
one,
a problem.
yes, that's a whole other subject.
Yes.
But yeah, incontinence, it can cause urinary tract. But I could do a whole talk on incontinence too because there's so many different types and such. But incontinence certainly can cause infection. Is there a specific question that you
No,
have?
it's just an issue for a lot of older people.
Yeah, yeah. And certainly you can be more susceptible to infection with incontinence. And too, I mentioned, if there's any sort of liner or feminine pad or male pad that you use to really change those frequently, because that's really a ground pool there for bacteria to breed and can enter the urethra there.
Are the cranberry tablets taken daily?
Yes. And over the counter, they're generally 250 milligrams. There's also 500, and there's not really evidence to say which milligrams work. But I always say, you know, either 250 milligrams daily or 250 milligrams twice a day.
If I could just mention about the incontinence, because, you know, incontinence, I think as Kayla said, it could be a whole new topic and maybe we could cover that.
Yeah.
I'm talking about that. But depending on what is causing the incontinence, if it's some spilling because your bladder is a muscle, so if the bladder is not working appropriately and it's not expelling all of the urine and some of that urine is staying in the bladder and the incontinence is kind of like a little bit of an overflow, great place for bacteria to form in that bladder to cause an infection. So it's the cleanliness, but also what's going on in the bladder. Is it just sitting in there and bacteria loving to get in and emptying? So, you know, another whole topic for the whole issue with incontinence, but surely the cleanliness is an issue, and also anyone that wears some kind of a product to make sure that it's being changed, you know, in a frequent amount of time. So once again, bacteria loves those warm spots that it can get up into your,
That's a subject area that I think would be useful to a lot of older people, whether they're infected or not. It's
No,
just
I
an
agree.
issue.
Of
that
course.
Body system becomes an issue.
Of course. I think it too, and maybe it will be a future topic, but there's so many different types as well. You know, there's stress incontinence, there's urge incontinence, overflow. There's a lot of different, and you know.
Or there's no reason in
Exactly, that's true too. So it's a big topic that I think deserves its own time to be talked about.
or medication related.
Yes.
Medication related, you want to have a diuretic and, you know.
Yeah.
If you have blood in your urine but you don't have a UTI, what can that be?
That can be, you know, and, you know, is it painless? If there's blood in the urine, you know, one thing we worry about is cancer, bladder cancer, renal cell cancer. So what we would actually do is, you know, send out a urinalysis and culture, and then it would proceed or prompt, usually a CAT scan to make sure that there's not a mass or something else that's causing the blood. Great. You're welcome. You're welcome.
Well, thank you so much, Kayla.
You're welcome.
Very nice.
You're welcome.
Very much. Thank you for coming.
Thank you for having me.